Hello, I'm Kimberly Guerrera from EmergeOrtho-Triangle Region's marketing team. I'm joined today by Dr. Aldridge, orthopedic surgeon specializing in the hand and upper extremity. Today we're going to be talking about arthritis of the hand and elbow and some of the most common questions that he receives from his patients. Alrighty, so an estimated 54.4 million adults have arthritis in the United States. So Dr. Aldridge, tell us, what do you enjoy most about treating arthritis of the hand and elbow?
Thanks, Kimberly.
You're welcome.
I think for me, the most enjoyable part is educating patients that the symptoms that they have are legitimate and there's a reason for it. And even further, there are treatments for that. Most patients come in, their hands hurt, they don't know why, or they do know why, and they thought that there was nothing that they could do for it. And so being able to educate the patients as to the true diagnosis and then going through with them the different treatment options can be very rewarding, because there's a lot of variety with that. There's different levels of activity, there are different demands in patients, and then there are different stages of that arthritis. So even though it's a singular problem, it manifests and presents in many different ways.
Wonderful. Alrighty, so now let's dive into the frequently asked questions. So what is arthritis? And I know that's a broad question.
It is a broad question, but let's just start with the root of the word. So, most things in medicine are broken down from previous Greek terms. So arthros is Greek for joint, and itis is inflammation. So technically it's just inflammation of the joint, but that also is a wide umbrella term. And there are almost 100 different varieties of arthritis. The three most common are osteoarthritis, which is sort of the garden variety arthritis that you inherit from your parents and they from theirs. There's rheumatoid arthritis, which is a autoimmune mediated form of arthritis where the immune system erroneously recognizes our joints as foreign to the body and begin an attack of the lining of the joints. And then the third most common is post-traumatic, and I would say those three are, for orthopedic surgeons at least, the top three. But each has its unique presentations and its unique set of patient population, and then subsequently different treatments for them.
All right. So what causes arthritis of the hand and elbow? And am I at risk?
Well, again, if it's rheumatoid arthritis, it's an immune-mediated attack of your joint lining. And characteristic for rheumatoid arthritis is that patients get, synovitis and inflamed, swollen joints. Osteoarthritis, again, is more of an inherited condition. And then the post-traumatic, obviously, if you have a wrist fracture, let's say, and your joint was not realigned properly and you had an irregularity of the joint, I would tell you that you would be at risk for later in life arthritis. But you're more likely to get osteoarthritis, which is inherited, and I can't really tell you without knowing your family history if you're at risk for that. But if you have a mother or a grandmother that has fingers that are a little swollen or angulated, the tips of the fingers, then they more likely than not have a form of osteoarthritis, and I would say that you are at risk. I couldn't tell you what the percentage is, but you would be at risk.
Gotcha. Alrighty. So what are these symptoms?
Well, the classic symptoms for arthritis of any joint is pain, and stiffness, limited motion, a feeling of fullness, and loss of strength, which is largely secondary to those prior symptoms, which is pain and loss of motion. So then you don't utilize that joint like you normally do, and the muscles surrounding the joint atrophy or get weak, and so you get weakness there. But stiffness, swelling, pain, those are sort of the classic features of arthritis.
Okay. So if I were to come in with that pain, how would you diagnose that I had arthritis?
Well, a good clinical exam goes a long way in making the diagnosis, and part of that exam is a good history taking. So, for example, if this is a middle-aged let's say 35-year-old female who's complaining of multiple joints that are warm and painful, and there's no trauma, and there's no history of, let's say, a tick bite that you can rule out Lyme disease, that would be somebody for whom I would work up for rheumatoid arthritis, versus 65-year-old male patient who's hard worker his whole life and he has a single joint that's painful and stiff, limited motion. I would be more thinking osteoarthritis. And then, of course, very helpful for that workup would be the acquisition of a plain x-ray, a radiograph, which we do in clinic, and you can discern quite a bit from just looking at the x-ray.
Gotcha. So how is arthritis treated, non-surgically and surgically?
Well, we certainly, and you put it in the right order. So we work our way up to surgery, using that as a option of last resort. Non-surgically, there's therapy. There's just the common, kind of Dr. Mom modalities, if you will, ice and rest and anti-inflammatories like Aleve and ibuprofen.
Gotcha.
There are cortisone injections, which, if utilized cautiously and judiciously, can be very helpful and not harmful. There are some viscose supplementation injections, which are shots that are given in the larger joints, typically the knees, where you're adding a substance to the joint that's of high viscosity, and it sort of lubricates the joint, and that can help with discomfort as well. Therapy can be utilized. Braces can be utilized. And then once you've exhausted all of those non-operative modalities, surgery can be quite helpful. And surgery can range from anything from a minimally invasive arthroscopic procedure where the surgeon is cleaning out the joint, removing the inflamed joint lining called the synovium, removing little pieces of bone that perhaps have broken off and that are floating around in the joint that can be causing harm and pain. Or it can be as dramatic as a replacement of the joint. And we have replacements for a multitude of joints in the body.
Wonderful. So if I were to have surgery, what are my limitations afterwards?
Well, that's a generic question that I can't give a generic answer to. It depends on what you have done. Obviously, the most dramatic procedure we do for joint arthritis is a joint replacement. And again, I can't give a generic answer for that, because depending on which joint it is that's replaced, there are going to be different restrictions. But I would go so far as to say that our goals with joint replacement of the upper extremity and lower extremity, for that matter, are resolution of pain, restoration of motion, and allowing you to get back into your normal life routine. And that can, include, for lower extremity joint replacements, running and other activities that you may think would not be allowable after joint replacement, but often can be.
Great. So last question, how can arthritis be prevented? Can it?
Well, unfortunately, we don't have the answer to that yet. I think that's sort of the holy grail for orthopedics and arthritis is preventing it. We are at this point relegated to treating it. There are interventions we can do to mitigate the symptoms, but assuming that it's not post-traumatic arthritis, there's not much we can do to prevent it. And just a word on that. So that is often the reason that we do operate on fractures that involve the joint. And that's one of the main drivers of that decision, is that restoring the anatomy is very helpful in preventing post-traumatic arthritis down the 5, 10, 15 years down the road. So yeah.
Perfect. Well, thank you so much for joining me today. If you viewers would like to learn more about Dr. Aldridge, I will be linking his bio in the description below. You may use that link to request an appointment with him or book an appointment online. Thank you so much for watching, and we will see you next time.